How many times per year to have PRP injections for hair loss? I am a 44-year-old male and recently had Neograft procedure, 1700 follicular units, as well as PRP injections for my thinning hair. I'm curious as to how many times per year I should get the PRP injections.
Thank you for your question. You submitted a question after undergoing a hair transplant where you had PRP and you're asking how many times per year to have PRP injection to treat hair loss. Well, certainly I can give you my perspective. I'm a board-certified cosmetic surgeon and I've been performing hair transplant surgery for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Systems, which is a technology we've developed to help people with thinning hair, both men and women, using PRP in combination with extracellular matrix and other ingredients. And we are actually extremely busy doing that as a non-surgical alternative to transplant. So we can certainly, and we have a lot of data to support the benefits of this treatment. So that being said, I'll share with you my perspective, and in no way would I disparage anybody, any other physician who believes in the use of PRP for hair loss. It is something that has been done a lot in the field. It's still a small percentage of doctors who do use PRP for hair loss. I would say that to understand what PRP does, you can think about how it's applied in other areas. A background of PRP was that it was first introduced by oral surgeons who are using PRP or platelet-rich plasma to help stimulate blood supply for the placement of dental implants into bone. And then it moved onto the orthopedic field, where it's commonly used for joint and tendon treatment. In aesthetics, in addition to my practice of treating hair, I do cosmetic surgery, so I do facelifts and eyelids and complex eyelid reconstructive surgery. And we use PRP a lot. We love it for complexion improvement. We use it for acne scars. We use it for scar treatment. So there's definitely a lot of value with the use of PRP. In my experience, PRP can help, such as in your case, where it can help the transplant heal better, just the way it can assist healing in other areas. But as far as treating thinning hair, I don't consider PRP of value on its own as a treatment for thinning hair. And I'll explain why. When you get down to the reality of thinning hair, for men, there is one factor that we know about called DHT or dihydrotestosterone, which to hair susceptible to the effects of DHT will thin, and that's the basis for drugs such as finasteride for blocking DHT. But in our practice, when we combined PRP with acellular matrix, we were actually able to stop the progression of hair loss and restore a significant amount of thinning hair. We made thinning hair become thicker. And this treatment has been basically a one-time treatment with maybe another treatment to kind of help boost even further the benefits by doing a treatment in a time based on an individual's response. But beyond that, we have data to show that these 1 to 2 injections can sustain hair growth and improvement for 3 to 5 years. Now, for most people who have PRP treatment, from what we understand when they come to us after being treated elsewhere, is they'll go for injections like once a month. And in practical terms, it is very difficult for someone to sustain that logistically. Even if they're really committed, after a few months, if they usually don't feel like they're getting that much benefit, and then they start looking for alternatives, and that's how they find us. I think that PRP cannot do what is intended. It may have, let's say, a comparable effect to something like minoxidil. Minoxidil prolongs the growth cycle of thinning hair. It is my observation that when you inject PRP, that you get some fine small hair growth, and you can maybe prolong the growth cycle a little bit. But I would not say that there is a good schedule for PRP alone. I think that from our experience, when we use PRP for hair loss, we do our Tricostem hair regeneration system to really get the results that we get, to the point where we have considerably decreased the number of hair transplants we do because of how effective this is. And the reality is that most people who seek hair transplants are people with thinning hair. So when someone with thinning hair comes in, they will often have come in because they reached a certain threshold in which they were uncomfortable. And once we do this injection and we follow them very closely. We follow them for at least 18 months. And then if we do another injection at some point, we follow them for another 18 months. And we follow them very, very closely. We document with photos, with microscopy. We really have a good system in place for that. When we look at their results, majority of people feel very satisfied and they don't go for a transplant. So I would say that you can learn more about hair regeneration, or our brand name is Tricostem, but we also refer to this as hair regeneration, which is basically changing whatever is the instruction that the hair had, at least for a specific amount of time, where it doesn't continue to thin, but rather grows thicker. And that has been very successful for us. So again, to summarize, I would not say that there is any ideal schedule for PRP alone, because I don't think it does much for thinning hair other than maybe prolong the growth cycle of the thinning hair, but it doesn't stop the progression. If you have thinning hair and you get PRP, you will still continue to lose hair. And in contrast with hair regeneration, we are seeing dramatic improvement for male pattern hair loss, which is, and more than 99% of men who come to us respond. It really works out very, very well. So I hope that was helpful. I wish you the best of luck. Thank you for your question.